On how to take blood pressure. First thing is you gotta make sure the client is resting at least 5 minutes in the chair, feet flat on the floor, back supported, and both arms resting on the table. And you gotta make sure the client did not take any caffeine at least 30 minutes prior to testing. Okay, this is the cuff. This mark right here lines up. It needs to be lined up with the artery, and then right here is the bladder, fills up with air, puts pressure on the arm. Here is the cuff measurements. If you go past this line, you need a smaller cuff. Over here, you would need a larger cuff. So now we're putting on the cuff, and what we got to do is make sure it's at heart level, and line up this mark right here with the artery and the bicep, and put it on nice and snug. So here is the stethoscope, and what you want to do is make sure they're facing forward when you put it on. Here, make sure it's on. What you're going to do is put it right where the artery is, under the cuff. So now we're using the sphygmometer, and what we're going to do is we're going to pump the air through here into the cuff. We're going to pump it all the way to 180, and the release rate right here, this will be the release, is 2 to 5 millimeters of mercury per second. And what we're listening for is the first sound, which will start the systolic pressure, and the last sound, which will mark the diastolic pressure.
Blood pressure classifications are for normal, less than 120 systolic, and less than 80 diastolic. Prehypertension is classified between 120 and 139 for systolic, or 80 and 89 for diastolic. Hypertension is 140 or higher for systolic, or 90 or higher for diastolic.